Can you please explain a little bit about your profession?
Sure. Well, my name is Asha Pillay. I am a registered nurse. I am currently a nurse manager at Medical City Hospitals of Dallas. Work on a diabetic endocrine floor. It's a 22-bed floor. We get patients with all types of illnesses, starting from people who have diabetic injuries, cellulitis, different things that come with having diabetes, to patients that are post-op, pre-op, surgical patients, people that are in DKA with blood sugars of 500 to 600, we bring it down to normal, as well as the opposite effect, people who have blood sugars in the 30s and 40s, which standard 70 to 110 is a normal good blood sugar. So we work with them, work with their diet, manage their diet. We work with physicians, we work with social work. It's a collaborative effort on our floor. We have physical therapy, occupational therapy, respiratory therapy, as well as caseworkers, social workers, physicians, rehab physicians, and nurses, nurse techs. So it's a pretty round, large scale of responsibilities to bring everybody together for the well-being of our patients. Make sure they have a great stay at our hospital, as well as they get healthy, attain their goals. We try to take care of families, because when the patient is sick, it also affects their families. So altogether, it's a large, encompassing position to bring everybody together to get to attain a goal of getting your patient in, getting them healthy, and then getting them out to discharge in a timely fashion so that they can get back to their life.
What made you want to go into the healthcare field?
I've had parents that are in the background with the medical field. A lot of my family's in the medical field, but mainly I volunteered and at hospitals before I became a nurse, and I just knew that nursing was something I would like to get into. Nursing is a great profession. It's an honorable profession. It has a huge scope of openings. It has a huge variety of things that you can do, different areas. If you're like children, you can go into pediatrics. Like adults, you can go into adult population. If you like critical patients, ICU. If you like acute patients, you can go into ER. If you like older patients, you go into geriatrics. If you like babies, L&D, and newborn nursery, management, caseworkers, and it's just endless. As to, there's no other profession, I believe, out there that you can test the waters to see where you fit the best, and you still have one license, one degree, but you have a wide variety of opportunities that you can find your fit. So they always say nursing is a job of many hats, so you can always take off one hat if you don't like it and go on to another. Great opportunity now. There's nurse practitioners, there's CRNAs who are nurse anesthetists, so it doesn't stop there. They're going to management. Their hospitals are run by nurses, so it's a great field, especially if you're looking into something where you could expand your experience, expand your knowledge. It's a continuing education all the time.
Is there anything you dislike about your job?
Oh, well, of course, when you get really sick patients and the outcome is not what is expected, or people come in and they think they have one illness, and then they end up, you do tests and you have to tell them, it's not that, it's something really worse, and it changes the whole course of their life. So you sometimes have to be a bearer of bad news. So that's something that you don't like. Also, you do run into people like nurses or physicians that don't make their patients happy, because this might not be the profession for them, and their bedside manner is not best. So at my position, I have to speak to those people and tell them their concerns, the patient's concerns, tell them, patient's not happy, remove them from that situation, which they maybe didn't know that that's how they were reacting with the patient. So it's like you have to manage and keep a good medium base for everybody to be happy.
What is your educational background, and can you explain a little bit about your path to becoming a part of the healthcare field?
My education background is I have a Bachelor of Science degree from Texas Women's University, which is one of the top rated nursing universities in the country. My educational path was, I started off after high school, and then I started thinking what kind of profession I wanted to be, started taking one prerequisite after another, then kind of bunched them all together, applied for the Bachelor of Science program at Texas Women's, which is a 2-year program. So it's a total of 4 years to get your degree. You have to have a 4.0 GPA going in with your prereqs into Texas Women's to get admission. It's highly competitive. So I feel lucky that I was able to do well and get into that program. Then it took me 2 years with clinical hours as well as classroom didactics to get my Bachelor of Science degree. So I currently hold a BS degree in science with an undergrad in nursing.
How did your undergrad studies help in grad school and or your job?
Texas Women's is a wonderful university. Like I said before, they teach you how to think outside the box, how to be a critical thinker, not just a bedside nurse. There's a difference. There's a difference between just handing out meds and following orders, and then there's a difference of being your patient advocate and looking beyond the box and looking at the whole family and the whole what's going on at that moment, and be able to relate to doctors as well as your other staff as well as your patients to get the entire picture of what's going on at that moment to get the best outcome for your patient. So as a nurse, you're always your patient's advocate. Everything goes from your hands, literally, to the patient's mouth. So you have to question everything. You need to know side effects as to what you're giving these patients. You need to know their history. Do they take this? Is it going to lower their blood pressure? Do they already have low blood pressure? Is it going to lower it anymore? These are just examples of what you need to think about before you actually medicate patients. Tests that are run. Are they allergic to the dye that's used? These are things that you need to know. The doctor might just write an order and say, this is what I want done. But then as the patient advocate, like I said, you're that stop between physician and the patient. You're the middle person. So you're the one who spends 12 hours of your day with that patient. And so you know what's going on with that patient. So then you'll call and you'll say, well, they can't really have this test because they're allergic to da-da-da, or they are claustrophobic, they can't be in an MRI machine, we need to get them some medication. So you're actually your patient advocate as well as the link between really every department in the hospital and that patient. You're the link that gets them to their test, you're the link that gets them their medicine, you're the link that makes sure they're safe, and you're the link that makes sure they're discharged and they go home back to the life that they had led before they got to the hospital.
What are your working hours and days? Is there some choice or control of your work schedule? Please explain.
Well, now nursing has gone to mainly 12-hour days. So you can either work nights or days at 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. So currently I am, like I said, in management. So I choose my days. I work 3 days, which works for my family schedule, Monday, Tuesdays, and Fridays, which is I get to work around 6:30. I leave about 7:30. So it's about a good 12 to 13-hour day, or maybe sometimes more. 3 days a week. So nursing is also very flexible. If you like working night shift, you can work nights. You're off all day. If you like only working weekends, you can work weekends. Nursing is a profession that it's just a wide variety of hours you can work. You can work 5 days a week. You can work 3 days a week. You can work hospitals. You can work community settings. You can work anywhere. So scheduling is the most flexible. If you want to have a family, if you want to have a second job, if you want to go to school, nursing is the best profession for all that.
Do you believe that you have job longevity in your current position? Why or why not? And also, do you believe your profession is in high demand? Why or why not?
Alerta.
Do you believe your profession is in high demand? Why or why not?
Oh yes, nursing is a position that there are tons of openings all over the place. Baby boomers are actually retiring, so it's one of the top professions if you look up the job market in the next 5 to 10 year projection that has a huge opening. So that's one profession that if you go to, you're guaranteed a job as soon as you graduate. There's so many hospitals, so many clinics, so many needs for nurses and in management as well as in all facets of nursing. So yes, job guarantee, job longevity is something that you will definitely find in the field of nursing.
What steps do you recommend for one to take to prepare to enter this field?
I really think everyone who is thinking of going to nursing should research nursing, shadow a nurse, and look and see where you would like to, if you do want to go into nursing, what field you'd like to go into, and then shadow that nurse and take some time to see what actually is being done and what your job would entail. And then I would suggest making sure you take your sciences and look at the colleges that are close to you or colleges you're interested in. See what type of entrance exams they have or entrance prerequisites they have, and start from there. And that way you're working your way towards getting admission into the program.
What skills, abilities, and personal attributes are essential to success in your job in this field?
Compassion is number one. You need to have a compassionate heart. You need to want to help people. You need to have a personality where you can interact with people, because you're seeing people at their worst, and meaning probably the worst, meaning they're sick. And so when people are sick, that's when they're not themselves, and you need to be the type of person to acknowledge that, be compassionate, be helpful, be someone that wants to see them get better, and that works as an advocate in that position to get them better. So compassion is number one.
Do you feel respected by others, such as coworkers, other health professionals, and patients? Why or why not?
Yes, definitely. If you look at a poll, the number one most respected profession out there, one of them is nursing. Nursing is respected by physicians. You're respected by your coworkers. You are, like I said, you are the center. There's a big circle, and in that center is the nurse. So you are the one who advocates, and you make sure everything is well. You talk to the doctors, you talk to other staff, you talk to your coworkers, you talk to other departments. You entail everyone and bring them all into that circle to get to that patient, to get them the best outcome. So nursing is one of, if not the most respected professions out there. Everyone's respected, everyone's great, but as a patient, the person who stays with them for 12 hours of their day and takes 12 hours away from their family to be with that one patient multiple days of the week is a nurse.
If you could do it all over again, would you choose the same path for yourself?
Oh, most definitely. I'm so satisfied in my job. I'm satisfied in what it can give me as a human being, towards my profession, towards my family. I have the hours that I can work that are very flexible. I have positions all over the country, all over the state and my city that I can apply for, that I can get with this license that I've worked hard to get. So yes, I would do it over again. And like I said, nursing is something that if I'm not satisfied today with what I'm doing on my floor, tomorrow I can go work with babies. Tomorrow I can work with senior citizens. I can go to the ICU. I can go to the ER. I can work at a clinic. I can work at a school, community health. That's just a small number of things that I could do if I wanted to change what I'm doing right now. And I don't have to go back to school.
Would you recommend this profession to someone who's interested?
Oh, yes, definitely. I always like to put it out there to any youth or anyone. It doesn't matter. Your age is not a factor in nursing. If you're interested and that's something that you want to do, I would definitely recommend it to anyone.
What advice do you have for anyone wanting to pursue a healthcare profession?
My main advice is to shadow. If you want to go, there's so many different areas of health profession. There's so many different areas. You can be a physician, you can be a pharmacist, you can be a nurse, you can be a tech, you can be a physical therapist. But make sure you go beyond what you just see. Research, read about it, shadow someone, go to hospitals, go to clinics, see what you actually are going to be doing once you get that degree. So that way you're not surprised or shocked once you've worked hard to get that degree. I just think anybody who wants to do anything in medical field should pursue that, definitely. You should make sure that you do some research, do some shadowing, talk to people, and that's something that I think that you would definitely get fulfillment in life with, and it will satisfy you for the rest of your life as to the profession you chose to do.
The opportunities for advancement at your current place of employment, what are your career goals?
Oh, advancement at my current facility is, if you are wanting to advance, meaning go up the ladder, go into management, be a clinical leader, do a case worker. There are so many avenues to that. First of all, it's through education, continuing education, as well as to promote yourself by going back to school, maybe getting your master's degree, maybe getting your graduate DNP. There's so much. You can be an NP. It just depends on what you want to do. And if there's some people that are satisfied working where they are for the rest of their life, they're happy, they're making a good living, they have the hours they want, they're satisfied, and then there are other people who would like to keep continuing. So to continue up the ladder, it's mainly education, and then show your desire and show that you are interested, and then higher up management will come and get you and move you on up the ladder. So it's just your interest and how much you're willing to work for it.